Oh, hello there. I'm Dr. Sarah. Pleased to meet you. Please make yourself comfortable there. Okay. Well, today you're here for your ear, nose and throat exam. Yeah? Have you been having some particular problems? Okay. Well, we can check that out for you. Okay, make sure there's nothing untoward up your nose. It might just be allergies that are causing your symptoms, but we can check that out for you. Yeah. Are you having any problems with your hearing at all? Not that you're aware of, okay. What about your eyes? I can check your eyes as well. A little bit sore sometimes, okay. And your throat. Okay. Alright. The stickiness could be postnasal drip, which comes down the back from your nose into your throat. Can be really troublesome at night sometimes as well. That's often due to allergies also. Yeah, but I can check that out for you. Yeah? Okay. So I'm just going to pop some gloves on. There we go. It's quite warm in here. Okay. So, firstly, I'd like to just have a little press around the sinuses on your face. Okay? Do you have any facial pain that you're aware of? Okay. Sometimes it's not that apparent until I press in certain places, so just let me know if anything's tender. Alright? I'm going to start here, the maxillary sinuses. Okay. Lovely, there we go. Just gently press around. Does anything hurt there? Okay. I'm just going to move up to the ethmoid and sphenoid sinuses, which are over here. Okay. Just at the top. Okay. How does that feel? Alright. Okay. Any pain or tenderness over the forehead? Okay. Alright. Okay. I'm just going to check your temperature, if that's okay. I'll just insert this into your ear. Alright, it won't hurt. Alright, just gently inserting that and you'll hear a little beep or two. Okay. Oh, that's perfect. That's absolutely fine. 36.9, which is absolutely perfect. Okay. So now I've had a little feel around those sinuses, alright? I just want to have a little look up your nose using this otoscope, okay? It might feel a little unusual, but tell me if anything is uncomfortable. Okay, I'll just gently lift up your nose, okay? Right. Just gently going to lift up there and have a look at the nostril. Okay. The lining of the nose looks fine. The turbinates are all intact and everything looks fine up there. Doesn't seem to be a deviated septum, which is the centre part of the nostril. Sometimes it can bend one way or the other. Okay, so let me just take a little look up this side. Thank you. Just inserting that there. There we go. Again, looks a little bit red on this side. A little bit more mucus. Turbinates are visible and fine. Okay. Alright. Okay. Just relax there. Okay. This side just looks a little bit more inflamed, which would be prevalent in an allergy, maybe. Yeah? Have you had allergies before? Yeah, okay. Of course, there are things we can be allergic to all year round. It doesn't have to be grass or, weed pollens, tree pollens. It could be all sorts of things. Yeah, but we can get you checked out for that if we think that is the problem. Okay, do you sneeze quite a bit? You do? Okay. Right then. So, just want to check your sense of smell. Alright. So could you just press that nostril for me? Okay. And breathe in and out. Okay. And the other side, press there and breathe in and out. Okay, how does that feel? Okay, good. Can you just give me a sniff? Alright, okay. Some drops here. Just going to hold this very gently under your nose there. Okay, so could you block off your left nostril for me and tell me what you can smell? That's correct, that's citrus. Okay, that one there, and get the other bottle. Okay. And could you block off your right nostril and tell me what you can smell now? Coffee. Perfect. I'm happy with that. Okay. Let me just have another little press around. Have you been getting any dizziness at all? A little sometimes? Okay. Well, let's just check your blood pressure. That's not a problem. We can soon do that. Okay. So, I'll just need to put the cuff onto your arm and inflate the cuff. Perfect. Let's get that there. Okay, just hold out your left arm for me. Thank you. There we go. And I'm going to inflate the cuff, and it's going to go rather tight. I'm sure you've had this done before, yeah? Okay. And I'll just pop my stethoscope onto the crease of your arm. Okay. Just breathe normally for me. Thank you. Let's get this inflated. Okay. There we go. Sorry, it's a bit tight. Let's let that down. Okay. That's all good. Let's remove the cuff. There we go. Perfect. Okay. While I've got my stethoscope here, I'll just have a little listen to your chest, if that's okay. Yeah? All right. It's nice and warm. It's been on your arm. Okay. So, just place that on your chest there. Deep breath in for me. And out. Wonderful. And in. And out. Keep doing that for me as I move the stethoscope. Thank you. Just going to pop round the back. In and out. That's perfect. Okay, and round this side. In and out. Okay. Okay, I'm just going to place this on your neck. Just breathe normally for me. Okay. And now just take a deep breath in and hold it. Okay, that's wonderful. Thank you. Okay, so everything's checking out fine there, just apart from that sore looking nostril. Okay, so for the next part of the exam, I'd like to just check your lymph nodes, if that's okay. Just down your neck. Alright. Keep nice and still and relaxed for me. Thank you. Just check down there. Okay. Just the pre-auricular there. Front of your ears. Post-auricular behind the ear. Okay. Okay, just round the back there. Wonderful. Okay. Underneath. And just under the chin there. Okay. I'm just going to feel across the clavicle there. Okay. Perfect, thank you. That seems fine. Could you just lift up your arm for me? I'll just feel under the armpit. This might tickle a little bit. Okay, thank you. I've got the weight of your arm there, that's fine. Just have a little press around. Okay, just relax that arm and let's have a look at this side. Okay. Everything feels fine there. Okay, so I just need to change my gloves and then we'll go on to check your mouth. Okay. Okay then. Nice fresh pair of gloves. And let's just take a look at your mouth and throat. Okay. So firstly, I'd just like you to open your mouth for me. Okay, and I'll just take a little look around with the light on its own at first, if that's okay. Alright, there we go. Okay, can you just say "oh" for me? Okay. Just pop your tongue to the roof of your mouth. Okay, and down. And just stick your tongue out for me, thank you. Okay. Now, I'm just going to use these tongue depressors just to move your cheeks, okay? And just to depress your tongue for a better look down your throat. Okay. Okay, so nice and wide for me, this won't hurt. Okay, just nice and wide. Just moving cheek to the side. Just take a look in there. Okay, just hold the tongue down there. Okay, and this side. Okay, right, bring my light back in now. Okay, just depressing the tongue there. And take another look. Could you say "oh" for me again, please? Okay, that's perfect. Let's move that cheek a little bit there. Everything seems fine. Okay, could you just give me a little cough? Wonderful. Wonderful. Okay. Now, just stick your tongue out for me again. I'm just going to take a look at the palate at the top. Okay, just come in a little bit closer. Okay. Do you have any soreness in your mouth at any time? Okay. Right. That looks great. Soft palate, hard palate seems fine. Okay. I can see you've had your tonsils removed there. Okay. No problems at all. Right, just relax now. Okay. I'm just going to place my hand gently on the side of your face there for checking the temporomandibular joint, okay? So just gently pop that there and there. Could you just open wide for me and close? That's perfect. And again. Okay. Could you just wiggle your jaw from side to side? Okay. Do you get any discomfort there at all? No? I couldn't feel any clicks or pops, so that's fine. Wonderful. Okay. Just make a note there. All good. Okay. Now I'm just going to take a closer look just in your cheeks to make sure that the skin on the inside there is all looking good. Okay, just coming in with this just to move away the tongue and just pulling the cheek away a little bit. It will feel a little bit uncomfortable, but it shouldn't hurt, okay? Alright, there we go. Everything looks fine now. Okay, and this side. Just move that away. That all looks fine too. Wonderful. Okay. Okay. So I'm going to move on and take a look at your ears. Yeah? Okay. Firstly, I just want to have a little palpate around the external ear, if that's okay. Alright. Let me know if anything feels tender at any point. Okay? Alright, we'll start with this ear, okay? Alright, so I'm just going to have palpate around the top, and I'm going to move down now. Anything feel uncomfortable there? Okay. On the lobe, just giving a little tug. Anything painful there? Okay. no lumps and bumps, no scarring, that's fine. Okay, so the external ear there looks fine and there's definitely no discomfort. Perfect. Let's take a look at this side. Okay, just pressing around the top. Okay, and down. Little tug on the lobe, does that hurt at all? No, okay. That's wonderful. Just a little look behind the ear. Okay, there's no bumps, scarring. Looks perfectly healthy. Okay. Ears look symmetrical too. Okay. I'm just going to give a little tug down on both of them. Alright. Is that okay? Perfect. Okay. So I've palpated the ears now. I'm going to have to take a look inside the ears, which I will use the otoscope. Alright. Gently insert the speculum inside and take a look around. Okay, if anything's uncomfortable, as always, please let me know. Okay. Alright then, so I'm just going to gently pull up and back on the ear. Okay, is that okay for you? Good. And gently inserting the otoscope now. There we go. Let's have a look at that ear canal. Looks a little bit red again. I do think you've got allergies. Does this ear itch? Yeah? Okay. Alright. I can see the eardrum now, and that does look pretty good. There might be a little bit more fluid behind there than I'd like to see. Okay, just repositioning there. Normal amount of earwax, that's fine. Okay. That's fine. Just going to withdraw that now. Alright, let me take a look at this one. Okay, I'm just going to pull up and back. Okay, just gently insert that now. Okay, there we go, gently inserting. Alright, this here looks fine actually. No redness, no swelling, no fluid behind the eardrum, no bulging or wrinkling of the eardrum. Okay, looks absolutely fine, the structures are all visible. Normal presentation there of the tympanic membrane. Okay, that's wonderful. Just going to withdraw that now. There we go. Okay, this side, just like this side of your sinuses seems fine, but this side does seem a little bit angry. Yeah, I think there may be an allergy going on that seems to be affecting one side more than the other. Yeah. Okay, so just going to check your hearing. Right. Firstly, I'm just going to use the tuning fork, okay, and I'm just going to ask you to tell me if you can hear the sound and then when the sound stops, okay, but I will need you just to close your eyes for this one, okay? Alright, so here we go. Okay, can you hear that? Tell me when it stops. Okay, well done. Let's try this side. Can you hear that? Okay, that's good. Tell me when it stops. Perfect. Okay. Here I've got a little clicker, and I just want you to tell me which side you hear it on, okay? close those eyes nice and tightly. Okay, you ready? Okay. Okay, perfect. Now, can you tell me where the sound is moving? Okay, so it went from right to left, that's perfect. And where can you hear it now? Okay, so can you hear this clearly? Yeah, can you hear that? Okay. Can you hear this clearly? Okay. Can you hear this? Okay. So I'm going to whisper a word into your left ear whilst clicking near your right ear, and I want you to tell me what that word is. You can open your eyes now anyway. Okay, you ready? Right. Hospital. Perfect. Okay, and I'm going to whisper into your right ear now and click near your left ear. Okay. Coconut. That's wonderful. Okay. I'm now going to whisper a few words into each ear, and I'd like you to repeat them, but I'll be rubbing my glove near the other ear. Okay? Perfect. Here we go. 22. Cat. House. Car. Wonderful. And same with the other side. Okay. Train. 96. Giraffe. Cream. Wonderful. Well, that all seems to be checking out fine. Okay, and I will have a little check of your eyes if that's okay, as a little extra. Okay, I'll give you a couple of minutes just to relax there, since I've been doing all that work around your ears. Okay. Okay then, I'm just going to do a couple of little checks around your eyes, if that's alright with you. Okay. So firstly, I'd just like to check your pupillary reaction. So just look straight at my nose, and I'm going to come in with my light. Okay, I'm just going to come across, look straight there for me. Okay. That looks absolutely fine. Absolutely fine. Okay. Now would you like to just follow the light for me? Keep your head still, but just follow. Okay? Alright. Just follow that wavy line. Okay. And up and down. Okay. And up and down. And up and down. Okay. Now while I've got my light, I'd just like to have a little look at the skin around your eyes, if that's okay. Just close your eyes for me, thank you. That looks wonderful. Okay, you can open your eyes now. Alright. So, I'm not going to be shining any more lights into your eyes. What I'd like you to do is just take a look at this chart here, okay? And can you read the top line for me, okay? Okay. So can you now read down as far as you can go for me, okay? And just keep going. Okay, well done. You can see better than I can. So I've got a smaller version of that here, okay? So what I'd like you to do is just read this little passage, okay, which is there. Just read that for me. Okay, can you read that line too? You should be able to if you've read that other passage, that's fine. Okay, what colour is this? Okay, and what colour is that? That's perfect. Okay. Well, I'm happy with that. You checked out fine, okay? Just apart from this nasal irritation there and the ear irritation on this side, okay? Are you taking any antihistamines at all? No? Okay, well, we'll get you a prescription printed, okay, for an antihistamine tablet. Just one a day, okay? I'm also going to give you some drops for this ear, okay, because you do have a little bit of otitis externa, which is just the irritation of the external ear canal, okay? And that will soon get that fixed. A few days, it will soon be feeling better. Alright. Try not to scratch. I know the ears can itch you if there's any allergic reactions or anything, but try not to scratch, okay? But everything else is checked out wonderfully well, okay? So I'll see you back here in a few weeks' time, unless you get worse, okay? And we'll discuss how the antihistamine is working for you. Alright? Okay. So, just remove my gloves. And we'll get that prescription sorted for you. Okay? Alright. Reception will have that for you in a moment, alright? Okay, so enjoy the rest of your day. And I'll see you shortly.